Good afternoon and welcome to today's Health and Wellbeing Board held on Thursday, the 15th of July. Can I remind people participating that this is recorded and webcast? And could I ask all attendees, apart from board members, please, to switch off their cameras, and can we all switch off microphones, please, until the point where we're speaking, just to help with the broadcast quality, hopefully. If I can move to item 1 then, please. Jenny, have we any apologies for the board?
We have received apologies from Dr. Naheem, Karen Jackson and Beth Hewitt.
Thank you. Anybody aware of any other apologies? No. I should have said as well, at a point where if you wish to speak or make a comment, could you put something in the chat line for me rather than hands up, please? Phil, would you go through the list of attendees, please, for the benefit of anybody viewing this recording?
Yeah. We've got yourself, Councillor Kendrick, Councillor Patterson, Councillor Pinnock, Councillor Khan. We've also got from the CCG, Carol McKenna, from Health Watch, Helen Hunter. From the council, there's Rachel Spencer Henshaw and Richard Parry. From Locala, representing the integrated board, there's Tim Bealey-Fox, who's subbing for Karen Jackson. From Mid Yorkshire Hospitals Trust, Trudy Davis. From Calderdale Huddersfield Trust, Catherine Riley. From Locala, Diane McKerricker. And from NHS England, Deborah Taylor-Tate, who I think is replacing Catherine Giles, who's previously attended the board meeting. And there's also Councillor Zaman, who's chair of Health and Care Scrutiny. Can I just mention, Chair, as well, that Rob Webster's previously been invited, but Rob is now acting as the interim chief exec of the West Yorkshire ICS. So I don't think Rob will be attending any future meetings in his role in relation to SWIFT. So, but we have actually got Tim Breeden, who subs for Rob on a regular basis.
Very good. And have you mentioned all the councillors present?
I think I have. The only councillor I've not mentioned is Councillor Thompson, who wasn't sure he was going to be able to make it, so it might just be a bit delayed.
Okay. Thank you very much. Welcome everybody anyway. It's good to see you all. If we move on to item 2, please, appointment of the deputy chair. Have we any nominations for a deputy chair of the Health and Wellbeing Board? Richard.
So, Chair, it's been the tradition, I think, since the inception of the board that the clinical chair of one of the CCGs is the deputy chair of the Health and Wellbeing Board, which I think is very important in terms of demonstrating that partnership that the Health and Wellbeing Board, whilst formally a committee of the council, is in fact a partnership arrangement. We're obviously now in a position where we have a single CCG for Kirklees rather than 2, but I propose that we continue that arrangement and therefore that the deputy chair is the clinical chair of the CCG.
Okay, thank you. Have we got a seconder for that?
I'm happy to second that, Chair. Which feels a bit unfair. He's not actually here, but I'm sure. I'm sure he'll be happy.
Does he know? Yeah, thank you. Have we any other nominations, please? No, I'm not seeing anybody indicating. Can we therefore record that he then becomes the deputy chair of the Health and Wellbeing Board, please? That's Dr. Khalid Neem.
Thank you.
Thank you. We all happy with that? No objections. Thank you. Minutes of the previous meeting, they're on pages 1 to 12 in the packs. If anybody's got any alterations or changes or omissions that they've identified, if they could let me know. Not seeing anything. No. And therefore, can I ask board members if you're happy to accept these as a true record of the minutes? unless somebody throws the hand up, I'm going to take that as consent. It's very difficult online, but there we are. I don't see anybody objecting, so we will take those as a true record of the minutes of the last meeting. So that item 5 is admission of the public. All the items on today's agenda are to be held in public, which moves us on to deputations and petitions. Jenny, have we any deputations or petitions to today's meeting?
None received, Chair.
Thank you. So I'll move very quickly to item 7, public question time. Have we had any questions sent in by members of the public, Jenny?
None received, Chair.
Thank you very much. Right, therefore we move swiftly then on to item 8, which is a COVID-19 update, and Rachel Spencer-Henschel is here to provide us with a verbal update. Over to you, Rachel. Thank you.
Thank you so much, Chair. I've got a few slides that I was going to take the board through, if you're okay with that.
Absolutely, yes. I didn't want to say you'd anything like that if you, unless you had.
So I had a bit of problems yesterday when I was presenting, so I'm just going to try and ask for you to confirm you can see what I'm going through, just so that I don't start going on and people can't see the slides. So just bear with me a second. Right. So can you see that slide that's headed vaccination uptake?
Yes, it's a little on the small side, perhaps for me, but.
Right, so I'm going to try and do it as a slideshow now. This is where I struggled yesterday.
Okay.
So is that a bit bigger on the screen?
It is indeed.
Right, now, has it moved to a different
it
slide?
Has.
Or is it?
Yes.
Right. Oh, okay, so that's bodes well. So thank you so much for having me, and I just wanted to talk a little bit about kind of the current situation in Kirklees and just pick up on a few key points in terms of the next phase, I guess, in relation to the pandemic. So starting with the vaccination uptake data, I think this is really important to start with kind of what has been a huge achievement for Kirklees across the partnership in terms of rolling out our vaccination programme. And I think that if anything is a testament to the partnership working we've got here, this is definitely it, because it has been absolutely a joint effort. What's been hugely heartening is the amount of work to get local pop-ups in place to try and do those drop-ins in some of our communities with the lowest uptake. So as you can see from this chart, and if you look at the map at the bottom, the darker areas are where we've got the lowest uptake of vaccine. So that goes to show you that actually, if you look at that as well as where our highest COVID infections have historically been throughout the pandemic, there is some correlation between those areas. So it's really important that we make sure that we are targeting those areas with the low uptake to increase people to get their first and indeed second doses. We have a community champions scheme, which is working on the ground. We've got over 70 different groups across Kirklees who are trying to work with local people to try and encourage uptake. But I think it's important to say that sometimes that can be quite time consuming. So there are conversations taking place all the time about how we move people from a position of perhaps being unsure about taking the vaccine to one where they feel confident. And it's really important that we don't lose momentum on that, because that's going to help us in terms of our population not experiencing serious illness and death, because we know that the vaccine programme is definitely the way that we can protect people the best. Now, on this next slide, and just confirm that it's moved, just so that it's still working. Brilliant. This is kind of how we compare, and actually, as you can see in the top, for first dose, we're around 76% across our population, and that kind of puts us kind of not quite in the centre, but certainly not into the lower end of the lower tier local authority areas, of which there's about 350. And then dose 2 uptake, we're a little bit higher comparatively in there. So we've still got some work to do, and to be honest, considering the diversity of our population, it's unlikely we're ever going to get to 100% of uptake, but it's just to reinforce that there's still a lot of work to do, and we need to continue that positive partnership approach that we've had so far. In terms of the vaccine impact, so when you're thinking about why we're doing the vaccination programme, the link between serious illness and death for the majority of the population and COVID is definitely what's changed in terms of this pandemic. So we've had no deaths in hospital within 28 days of a positive COVID test. And actually, although we're seeing a slight increase in the number of patients in our trust being treated for COVID, so that's slightly different to those that have had a diagnosis within 28 days. It's people that have been treated for acute COVID. It's still nowhere near what we would have seen in previous peaks when we hadn't got the vaccination programme. But I think it's important that we keep an eye on this, because there are still people who are vulnerable within our population, and we need to make sure that we're doing everything that we can to support them and ensure they've got access to that vaccination programme. So I just wanted to touch on the excess deaths and overall deaths for Kirklees, which is a slide I think we've touched on before here, which just shows kind of the seasonal pattern of deaths, and it helps to identify where we have excess deaths. And you can see that in that graph over the past year, where it's the darker blue, that's where we've seen COVID deaths, which has obviously significantly increased significantly increased our excess deaths for Kirklees. But as you can see on the right hand side of the graph, we're definitely not seeing significant excess deaths. Now, that doesn't mean that there isn't challenges in the system more broadly, but it's always a good indicator to keep an eye on in terms of what's happening across the population. Moving on to infection rates. So we've seen infection rates rise recently, and in fact, they are up by 46% on the previous week. Interestingly, we rank 55th in the country out of 149 local authorities. What's quite interesting in that is that, if you may recall, that back in May we were second in the country, and our rate is obviously a lot higher now than it was then. But what we're seeing is the rest of the country are starting to see increased rates as well. So we have got a rate of 339 per 100,000. And if you can see on the left-hand side of the graph, and I know that it's a bit of a small graph, but the blue line is Kirklees, and you can kind of see how that's sort of tracking the England average, which is the orange line. So I've always found Kirklees' trajectory in COVID really interesting, because we kind of often appear earlier as an area of concern and that we've got high rates, and then we haven't sort of seen the kind of huge exponential rise that if you look at that one that's going up right up to 1,400, that's South Tyneside, and they've seen a massive increase in cases. Now, it's hard to know what one thing we can put that down to, but I think that the surge testing initiatives that were put in place in May really helped to try and break some of those chains of transmission. And equally, I think the vaccination pop-ups and the acceleration of that vaccination programme that our NHS partners led has also helped in terms of trying to increase the number of people who've been vaccinated, and therefore hopefully reducing transmission. We have the lowest rate in West Yorkshire currently. Other West Yorkshire areas have seen a bigger increase, but again, when you look at graphs like this, you're never necessarily in the same position for very long, and things can change. But it's heartening to see that in terms of deaths and serious illness from COVID, the impact is not being felt to the extent that it was certainly in previous peaks. If you break that data down by ward, the ward with the highest number of cases in the last week was Home Valley South, followed by Birstall and Birkenshaw. Now, I think this is quite an interesting pattern, and I'll just move on to the next slide because I think this sort of helps to illustrate it. Oops, that's it. So you can see how the latest week is on the left in the blue. And obviously the darker blue is the highest number of cases. on the right hand side graph is how that's changed. So the increases that we've seen in the previous month. So you can see that actually in some of the areas that we knew we had high case rates when we started surge testing, they're now lower, and then we're seeing increases in other areas. So I just think it's important to remember that this is not necessarily concentrated in one particular area of the district, and it is all over, and predominantly in certain age groups. So I'll come on to onto ages now. So the highest rates are in our 10 to 18s. But actually, as you can see from the right hand side of that table, they have increased across the majority of age groups. Now, you would expect that because there are more cases. So by default, those numbers will go up. But it's still significantly lower in the kind of, definitely in the over 80s, but also in that older age group. So that could reflect the time that they have been fully vaccinated as compared to younger age groups. But certainly this mirrors the trends that we've seen across the country in terms of case rates in that younger age group. And clearly the vaccination programme is eligible for anyone over the age of 18 now. So it's really important that we do our best to encourage particularly those in the 20 to 29-year-olds and the 18 and 19-year-olds to go and get their vaccine. We've got a pop-up coming up at Greenhead Park, and we're working with a number of sports clubs to try and increase uptake. Anecdotally, I'm told that the uptake in younger populations is better in women than it is in men. So trying to get our young men to come forward for vaccinations is going to be important to make sure we've got that herd immunity, and that we make sure that we've got good coverage across all of our age groups. And then just finally, I just put this up really in terms of we're still seeing, a lot of tests in Kirklees. People are still accessing tests, and the positivity, as you would expect, because of the case rates in the population, that's going up. But I think it was just to reinforce that, we're seeing a lot of tests each week in Kirklees, and we'll continue to use testing as another mitigation in terms of managing this virus. So I'm just going to end the slideshow, and have I done that successfully, Chair?
Not up, nearly. One more button, I think. You may remove it.
There. Is that done?
Yes, it is. Well done.
Brilliant. Okay. So if it's okay, I was just going to just briefly touch on what's happening, obviously on the 19th of July and the 16th of August, if that's helpful.
That will be very helpful.
So I think obviously the roadmap is being continued at the pace that was described, and that was confirmed on Monday. I think that what's happening on the 19th of July is that the expectations and the legal position in relation to hands, face, space is being removed. And then but the expectation is that if you are a contact of a positive case, you will still need to self-isolate. So that will present some challenges in the system, I suspect, from partners on the board, but also for other settings in terms of managing how they keep the risk low, but equally not having necessarily regulatory powers to undertake some of that. So then post the 16th of August, we're looking at the rules for self-isolation to be removed for contacts. And if you are a close contact of a positive case, you will be encouraged to get a PCR test to see whether you are positive as well. So it looks like, things are changing based on the obvious impact of the vaccination programme in terms of serious illness and death. I think it's important at this point to say that, wearing a face covering, washing your hands regularly, and keeping your distance from people, plenty of ventilation, they will still help to keep the virus levels down. And I think it's important that we all do, the kind thing in terms of how we support ourselves and each other, and make sure that we're doing everything we can to minimise the transmission of the virus. Because even though people might not get seriously ill, some people will, And, you know, I think it's important that we continue that kindness we've shown throughout the pandemic and keep those measures in place where it's appropriate in order to support our most vulnerable. Thank you, Chair.
Thank you very much, Rachel. I did say, or I think I did say earlier, if people wanted to ask a question to put it in the chat, but I've been into the chat that I have and it won't load. So either you put it in the chat and Jenny can tell me who's wanting to speak, or put your hands up and I'll try and figure out who you are from the numbers. Has anybody got any questions for Rachel or any comments as such? Kath Pinnock.
Yeah, thanks, Rachel, very much for that comprehensive update. I'm wondering what will happen when lateral flow tests, particularly, are become payable, charged for. You know, when the availability of free tests ends. Have we any idea of what implications that has? And do we know what the likely cost of them will be?
Thank you, Councillor Pinnock. To be honest, I don't know the cost question, and I still think, from my understanding, the testing strategy is being finalised in terms of what that's going to look like, particularly post the 16th of August, because obviously the PCR testing expectations for contacts we will need to ensure we've got the capacity to deliver that locally, so that it doesn't prevent people from getting their test quickly and getting their result back quickly. LFT testing is an interesting one because it has a really important role in taking people who are highly infectious but completely asymptomatic out of circulation. But they are by no means perfect. And interestingly, I've had a number of conversations this week with people who said, well, I've just had my positive PCR and I did an LFT and it was negative. So there is a very mixed, it's quite hard as well because it depends on how good you are at doing them, because they're not particularly pleasant, as I'm sure you'll be aware. So I think that there will be a government announcement about the role of LFT testing in that broader testing strategy, but there's still some things that need to be confirmed around how that PCR testing capacity will be met post the 16th of August for close contact. So I think it's a watch this space at this point. But for me, I'd want to be able to see a mixed model that uses the best of all of those things to do as much as we can to reduce the transmission.
Thank you for that. Anybody else wanted to ask a question or make a comment? I'm not seeing anything.
I can see
Hunter's
Helen.
got her hands raised.
Oh, Helen, you have got your hand raised. So my apologies, Helen.
No problem, that's absolutely fine. Thank you so much for the presentation. That was really, really useful. I've just popped in the chat, which I realise Vivna can't see, is the Greenhead Park walk-up vaccination will be available from 12 till 7 on Saturday, just because I think it's so important to make sure we're getting the information out there, mainly because when we have published dates of the pop-up clinics on our website, we've seen traffic to our website like we've never seen it before. So we had about 5,000 hits in a day when we posted details of the pop-up vaccination clinics, which means people are looking for that information. They are keen to find out when things are happening. So something so important about making sure that that information is as readily available as it possibly can be through any of our different organisations. I think the question that I wanted to ask, and it's wider than the public health team, is about, with such high levels of the virus in our population, what impact are we seeing in terms of our health and care delivery, with people needing to self-isolate because of their contact with people who have the virus? I am very acutely aware of how many of my colleagues have children at home at the moment and have had several times in the last few months, and whether we're having, whether that has a really noticeable impact in terms of our delivery of health and care.
Shall I come in on that? Is that okay, Chair?
Yeah, absolutely fine.
I mean, it just so happens, Helen, a few of us have just come from a Kirklees partnership executive briefing, and we've been having exactly that conversation. I think it is fair to say that the system in general is running really, really hot at the moment, and that's across the board, you know, from primary care through to 999 ambulance services and, you know, our acutes and community services, mental health, everything is experiencing extremely high levels of demand. And like you say, one of the complicating factors in all of that is staff self-isolating. So you're right to point it out, it is a factor, and there are, you know, there's the usual regular escalation calls and mechanisms in place, and you know, part of that conversation is about trying to ensure that we prioritise everything as far as we possibly can, which you might expect, but it is a very, very current challenge, yes.
Absolutely right. And of course, the more the infection spread, the more frontline staff from all over key areas could well be disappearing, you know, out of the picture for a while. Any other questions or comments before? Oh, Deborah Taylor-Tate.
Hello, thank you, Chair. Just from an NHS England perspective, we are hoping that within the next 24 hours there is some guidance around self-isolating for health and care staff. I'm not quite sure of the detail, but I do know that there has been some regional conversations around can we take a regional approach. So as soon as anything comes out, Carol, I'll forward it on to you. But we're hoping that it will come within the next 24 hours, and it will also include some guidance around mask wearing for NHS staff and care staff, and of course our patients. So I do hope that something will come out, and as soon as it does, I'll get it out to systems so that they can start to understand what that means. But just to reiterate what Carol's saying, you know, it is having a huge impact, Helen, on, you know, the delivery and the ability for us to have those staff to do that work. But it needs to be, you know, a signed off, absolutely clinical direction. So that's why there's a little bit of cautious, but it should come out within the next 24 hours.
Thank you very much for that, Deborah. That would be really useful. Dr. Khalid Naeem, before you start, I know you were not able to join us at the beginning. So in your absence, we elected you as Deputy Chair of the Health and Wellbeing Board. I just thought I ought to break the news to you. I hope that's not too much of a shock.
Thank you very much. I was in LMC meeting and
yes.
They were overrunning, so it took me a bit longer. I do apologize. You know, on that conversation, I've had a stream of emails now that we are looking at some SOPs being developed by our acute trusts, and they're being shared among us, and we are now planning to implement them in primary care as well, so as much as possible to protect the staff and the patient both.
That's useful, thank you. Anyone else? I've got a question, then I'll indulge myself, Rachel. I noticed when I get the things like the Local Government Association news, 3 or 4 councils and their health partners announced that they were intending doing vaccinations for young people 16 plus. Is that something that's been looked at in this area?
Well, I can answer that as best I can, but my clinical colleagues may have a view on it. My understanding is that we're still waiting for JCVI to publish their advice on vaccinating under 18s, and I think they're looking at all the evidence in terms of benefits along with any risk factors and making a determination. I believe that the position in Kirklees and the position that's been held consistently at this region is that we wouldn't routinely vaccinate under 18s unless they were clinically extremely vulnerable. But I'll let Dr. Naeem come in because he will probably have the clinical perspective on this.
I can see he's eager to tell us. Go ahead, please.
Yeah, I can say that there are only 2 categories of under 18s being vaccinated. One is the clinically vulnerable, and the other category is the ones who are volunteering at the sites. And these are the 2 categories which have been vaccinated. But apart from that, our advices that no under 18s until JCVI advises, and I'm pretty sure that it will start somewhere in August, late August or early September. That we start vaccinating the young ones, but I'm not sure. With increasing number of infections among younger ones, JCVI may probably bring it forward. So let's watch the space.
Okay, we'll await news of that then. Thank you very much for that. Anyone else? No? Can I thank you, Rachel, for a very full and really useful presentation. That's been most helpful. Thank you very much. So if we could move on then to item 9, please. Showcasing innovation, the Kirklees local offer, and I'm hoping with Tom, oh there he is, Tom Brailsford is here to do a presentation on this for us. Thank you. Over to you, Tom.
Thank you, Chair. So this is the start of, I think, 3 children-related items which we'll be going through. And we've actually got Richard Dresser, who's going to showcase the local offer for us as part of that as a first item. Then I'm going to talk about the SEND Transformation and Improvement Plan and the SEND TEF. And then we've got Mary talking about the Children and Young People's Plan. So I'll just hand over to Kelsey Clark-Davis just to introduce and give a bit of background in relation to the local offer, and then Richard will come in and give us an update and a demonstration.
Lovely, thank you.
Thank you, Tom, and thank you, colleagues, for having us today. My name is Kelsey Clark-Davis. I joined the authority at the end of February as Head of Education, Safeguarding and Inclusion in Kirklees, and yeah, really excited to be here today to talk to you about our relaunched local offer. This is, for those that don't know, it's basically a one-stop shop for our children, families and professionals who are working with children and young people with additional needs. Try and signpost really to all the services and support that are available. And more than that, to also identify services and support that aren't available and then work with commissioners to be able to implement them. We're really proud of our relaunched local offer, which Richard's going to be able to give us more detail around. I'll introduce my colleague Richard Dresser in a moment, who is one of the leads in the local offer team. Some really innovative practice going on. Hopefully you'll like what you have to see. And Richard's going to talk to you not just about the website that's been launched, but also about a new service that we recently launched called our ISO, or Inclusion Support Offer, which is also like a front door almost for professionals working with children and young people with additional needs, so that the team within the local offer can then support and signpost professionals. So Richard's got the detail. I think he's got some slides to share with you. I don't know if you're there, Richard, if you're able to come in now.
Hi, yes, I'm here. I'm just uploading my slides right now. I'll start as soon as they have uploaded.
While Richard's doing that, I think what is, I'm sure he will talk about, but one of the things that we're really proud of is the fact that it's really a live document that's changing and evolving all the time with the local offer. And one of the key bits, if you got a chance to Google it afterwards, Kirklees local offer, and have a look at the You Said We Did page, which just shows it's really responsive in terms of us listening and engaging with our families and young people, and how we then respond after we take that feedback.
Any luck, Richard?
It gets halfway with loading and then stops.
Oh.
Now I know that normally we don't share screens in this. I do have it open on my other screen, so I could share the screen if you like.
Yeah.
Right, okay. Okay, I'm sharing the screen instead. Okay, can everyone see that?
Yes, it's there now.
Brilliant. Right, okay. Okay, so thank you, Kelsey, for the introduction. So I think Kelsey's covered a lot of, I think it's come up now, actually. She's covered a lot of what the local offer is about, but I'll go through it as well. So what is the local offer? So the local offer it's one place within Kirklees where families and young people with special educational needs can get all the information they need about services And it's not just services that are available from Kirklees, it's about services that we expect them to be available to them. So that may well mean that there's some independent services on there. There might be some independent education settings as well. We don't endorse one service or another. We simply signpost and let people know what is there. Now, the local offer does actually sit within the Children's and Families Act, and the SEND Code of Practice has been a requirement, so it's something we do need to have. So in Kirklees, we launched a new website in December 2020. It was kind of a soft launch, and the soft launch was down to a lot to COVID, but it was successfully launched. And it's constantly evolving. We now have a team of 6 people working on the local offer, including 2 people working on the inclusion support offer, which I'll talk about later. And that has given us the capacity to really push this forward. So what information? It's everything from education, health, care, as well as third sector and community, anything that could be of benefit of use to those with special educational needs. The aims are that it helps with the early intervention of supporting those with special educational needs, and it's looking at things that can be done before you look at assessed services. It also, the aim is to enable families to access some self-help services, such as mental health, things like Couth and Young Minds, things that they can do at home, which would help straight away. And the aims also is to input into commissioning. So we can, we work a lot with families, with young people, with services, looking at gaps, and we feed that into the commissioning process. So why did we redevelop it? So this is, I think, the 3rd local offer that the council has had. The previous ones, that wasn't very comprehensive. It was quite, it was brief. It didn't cover everything. There wasn't the capacity to actually do what it needed to do. It wasn't very well known, and one thing that it really wasn't was co-produced. Now, actually, the Code of Practice and the Children's and Families Act specifies it's really important that it is co-produced along with those that would use it, such as families and young people. So the key principles we've worked on now is that it's comprehensive, that it covers everything. It's up to date. Like I said, we've got a team which gives us capacity to do that. It's collaborative. We work really closely with those that give us the information as well as those that use the information. We make sure it's accessible. So the new website follows the new accessibility standards. We also use a lot of videos and illustrations to make sure it's accessible to everybody. We have a large easy read section so that those with learning difficulties can use it. It's also transparent in that we let people know who makes decisions. We let people know how to contact somebody who offers a service. We make sure that it's really, really clear. So just an example here. This is the old site. It just looked like a normal council site, which is fine for council use, but it wasn't very appealing to young people. It wasn't very appealing to families, and they didn't find it very easy to navigate. So this is an example of the new site. Now, a lot of the work we did prior to the launch was with young people, with families, mainly Pecan and Kayas that we worked with a lot, which Pecan, if you're not familiar, is parents and carers of additional needs in Kirklees. It's a large parent forum. I think they've got 500 plus members. And then Kayas is it's the SENDIAS service, the special needs independent advice line, and they work with a lot of parents, and they helped us to come up with a design of the new site, even down to the banners, to the colours, to the use of icons. We've got interactive maps on there that helped us understand how that might work. They helped us with videos and just generally how pages might look. They also helped us develop an ethos that every page tells the user what it is we're talking about, who's it for, and how to access it. And the how to access it was something that was sometimes missing off a lot of pages and a lot of the information. So with the co-production, as I've touched on this already, we used a restorative approach of working with and not just to. We made sure we listened to a wide range of people, and like I said, it's been involved in the design and look, so that people are not turned off as soon as they look at the site. They really want to go into it. And we continue to work with young people and with parents, with families, with support groups to test the site. We have Pecan doing mystery shopper sessions where they'll ask a parent just to go off and try and find a certain bit of information, then they'll feed back to us, and if it doesn't work, we're able to change it. Now, with the children and young people engagement, it has obviously been limited because of COVID. A lot of young people have been engaging with education through means like we are today. And they found that, especially with children with special educational needs, they found that really challenging. We did some initial work with the Your Voice team, gathering some views on what young people might want from a website. And interesting, a lot of them told us actually they wanted it on social media, which is something we are working on. We are now working with a couple of groups at Ravensall School, and that's been really, really positive. We've spent a lot of time building relationships with the young people, and they're now telling us about the sort of information that they want. We're using that information to directly inform the young person's side of the local offer. We're also using that to help us develop our social media side of it. We are hoping to also start working with Pivot in September, which is one of our alternative provisions, and we are also reaching out to mainstream schools as well. What we're hoping is that as things move back to some level of normality, certainly in terms of the number of students actually in school, then hopefully we'll be able to increase our work there. So some recent developments, and this unfortunately is a little out of date just because we do move things quite quickly. We've developed a number of animations and a number of films that address the themes of like what is the local offer, just make it really clear. We've just done one called I Need Help with My Child, because one thing families told us is they don't always know that it's special needs or SEND that they need help. They just they need help. So we've taken that approach. We've done a nice, easy to use video that tells people you can go to the local offer, it'll help you with this, that and the other. And then we have a page called I Need Help with My Child, which helps them. We've also just developed a news feed service, which is similar to a news feed you might find on a social media platform, and it just gives short updates on what's happening in the SEND world in Kirklees. It helps us be able to just let parents know quickly about information about something that might be happening. This is also going to be mirrored on our social media feed. Now we're aware that we've got the same thing on two different platforms, but what's really clear is that some users are going to use the website, some people are going to use social media, and young people and families have told us that often they just want information given to them. So that's a way of doing that. We also have an events calendar because families have told us they find it really, really hard to find inclusive activities for young people. So we're launching an events calendar, I think, at the end of this month, which will help families quickly find out what is going on this week, next week, this month, and where it is. So they're all developments. So as Kelsey's mentioned about the inclusion support offer, this is a project that we've worked on alongside our partners in Power. And what this aims to do is provide direct support for SENCOs, that's the special needs coordinators in schools, so that they've got someone that they can speak to and talk through a case. Now, we don't deal with the personal information and the personal details of a child. That's not the important bit. It's about what have you tried, what else could be out there. And the teams consists of Jenny and Laura. Jenny's from the early years SEN team. Laura came from the early support team, and they used their expertise to take away that case, think about it, discuss it amongst themselves, and then go back to the school with results, with resources, with ways that they could work differently and different things they could try. And we've got just a few little bits of measures of impact, and 93% of people who used it found it very, very helpful. 100% said they'd use it again. There's a figure there which might not make sense about confidence, about pre-call and post-call confidence. The higher it is, the less confident they were. So they felt confident about the advice they've been given, more so after the call. If anybody does want to talk to me about those figures, I can put you on to Jenny and Laurie, who will talk you through them with more detail. But generally, the picture is that SENCO's schools have found it really, really useful. It's been something that a lot of people have told us they've been crying out for, and they found it very, really, really useful. We've got a couple of little projects that we're working with. We're working closely with the Children's Disability team. We have joint funded a participation group with them, which looks at providing activities for young people with special needs. Working with the Children's Disability team helps us kind of identify shared commissioning priorities, things that come up actually. Families might need support. They need a type of support both at school and at home, so it's helped us identify that. Working with Ravensall, we've done a little bit of mini commissioning where they've told us that they would really like to do parkour, which is It's free running. If you don't know what it is, please Google it, and you can see some quite exciting videos about it. And they're really, really keen to do it, but no one was able to offer it. So we're working with Pennine Gymnastics, who offer parkour, who are going to do some free sessions, which will help them develop their offer to people with special needs, and it'll also give the Ravenhill kids something fun to do. And they also have said that they'd like to produce some videos for us. They've identified some themes that they want more information on, and actually they're going to help us produce them, which will help other young people. So the kind of vision of the local offer, we want it to be responsive. We want to be able to quickly provide information for people, quickly respond if there's any feedback, quickly action any sort of commissioning things that come up that we can deal with quickly. And like I say, because we've got capacity, it's given us the ability to be responsive. We want to be pathfinding and innovative, and look at creative ways that we can provide that sort of early level of support to families. And again, that might be through self-help things, it might be through videos that would give guidance, it might be signposting to support groups, it might be signposting to third sector. We also want it to be broad. We work with people from across all services, both within and without Kirklees. We want to, we want it to be holistic, so it considers the whole child. And as we've said before, it wants to be co-produced and co-owned. It needs to be something that involves everybody. So the last thing to say is, how can anybody support the local offer is, if you come across a gap, it'd be great if you went away and had a look. Just simply Google Kirklees local offer. If you notice something that you don't like, notice some gap in information, please let us know. And also, please share it with people. We're trying, we really want to promote the use of the local offer, and we want people to feed back to us if there's any gaps, because the strength of it is working with other people, and then letting us know if the information isn't right, and we have the capacity to do that. So I realised I've rattled through that rather quickly, but that is the end of my presentation, and I will try and end it. Stop presenting. There we go.
Thank you very much, Richard. You've passed the IT test.
Thank you.
So, any comments or questions for Richard, please? Tom.
Yeah, thanks, Chair. Just to contextualise, I think as part of the next items about the SEND transformation plan and the improvement plan, and maybe we've done this in a slightly wrong order, because you'll see the context of the inclusion support offer and the local offer within our kind of early intervention work stream as part of our overall plan. So we'll touch on that in the next item, but I just wanted to make you aware, Chair.
Thank you very much. Anybody else? Comment or question? Carol McKenna.
It's really just a comment, Chair, and I think this is fantastic. I googled it as soon as you said, and I've been looking at it as you've been talking, just so you can see it.
Me too.
Live. Really, it's really good. And I mean, Tom will remember when we did the peer review. It was a couple of years ago now, Tom. I always think of things as either, before lockdown or after. It was definitely before, wasn't it? And this was one of the areas that we knew there was more work to do on, wasn't it? And it's fantastic to see all this done. I think it's really good. So thank you for the presentation of it today.
Thank you.
Thanks, Carl. And sorry, Chair, but I think the other thing that maybe we've not pointed out as well is that the self-help element of some of it. So what we have done is one of the things we did a couple of years ago was commissioned some sensory OT provision jointly with the CCG and the schools, and the sensory OTs have done things like put self-help videos on there, talk about what sensory occupational therapy does, tips and activities. So it's really good for that kind of thing for any services to, if you were doing a kind of what is CAMS or what is sensory OT, it's really interactive in that way. But you're right, Carol, it really has moved on in the past couple of years.
Yeah, it is very bright, very vibrant, and I love that sort of co-production element to it. I think that's absolutely essential. Any other questions or comments? I'll make one. I'll indulge myself then yet again. One suggestion is, and you wanted to promote it, and you're quite right to want it promoted. You may have already done so, and if so, it's passed me by. But a link to it, email it to counsellors. It's something we can promote through our social media links. I certainly am sure colleagues would welcome doing that. And I did go on it while Richard was talking, and of course I went back to my previous occupation when in employment, and I looked at the finance bit, and I don't see anything that links people to our own benefit advice service. And I have to say, parents of children with special educational needs very often do need advice and advocacy around benefits. So I would suggest that. Anybody else? No? Well, I have to say that's probably one of the most colourful bits of parts of the website family of Kirklees, and one of the easiest ones to navigate. I was able to scoot around it while you were talking, Richard, which I have to say other parts of the website defeat me every day. So I do think it's an excellent piece of work, and I'd like to thank you and Kelsey for coming and presenting it today. Thank you very much. So if we can move it onto the Kirklees Sense system, which is the one that you're doing, Tom, I believe.
That's right, Chair. Thank you. Phil, are you okay to do the slides? Thank you very much. Brill. So, you know, members may well be aware that we came, I think it was probably about 8-9 months ago now, to discuss our inclusive ambitions around SEND and children with additional needs, and how we could support families across Kirklees. That was the kind of first point of us laying the foundations really for our SEND transformation plan. So today what I'm going to do, talk you through where we are in terms of our self-assessment across the partnership, and then talk you through some of the key areas of the SEND transformation plan which will help to address that, if that's okay. So next slide please, Phil. So it's worth just saying we are overdue our joint CQC and Ofsted SEND inspection. We're one of the 5 areas in Yorkshire and Humber that have never been inspected since the changes in 2014. So just to bring into view for people what the inspection looks at. Fundamentally looks at how, as a partnership, we identify children's needs who have special educational needs and disabilities, so how effective we are at identifying as early as possible. Then it looks at how effective we are in terms of assessing and meeting those needs for our children and young people. And then thirdly, it looks at how effective we are in improving outcomes across the board. So as part of our preparation for the inspection, we've done an assessment of our strengths and weaknesses across the board. Next slide, Phil. It's also worth just saying that in preparation for inspections, the NHS England and the DFE are asked to meet with the 5 areas who haven't yet had an inspection to look at the following themes that are on the slide, just to check our readiness and where they felt we were against those 9 areas. Our meeting with NHS England and the DFE went very well, and we'll continue to have supportive conversations with them. Next slide, Phil. So our approach locally to SEND is we need strong strategic oversight of our ambition and our inclusive ambition to deliver the expectations of the Children and Families Act. Do you know, our aspirations for our children and young people are no different than they are for the rest of our children and young people. We want all our children and young people to have the best start in life. We're really keen to move to a more strengths-based restorative model with children and families, where we focus less on weaknesses or areas for development, more on strengths, doing 2 co-producing plans and making sure that families are really involved in person-centred planning. We really want to encourage a diverse range of services to meet needs in Kirklees. We want to kind of make sure we stimulate in the market, making sure we can be as creative as possible. Obviously, the Health and Social Care White Paper or Bill does offer us a lot of opportunities now to think about how we do things differently across the system. So we're going to take full opportunity of those areas. Obviously, the COVID pandemic has brought unprecedented challenges in the way we deliver services and how they work, and we want to keep the learning from those services and kind of the things we've kind of done around blended learning, the creative offers we've had about respite, and build them into our future modelling. But actually delivering the SEND outcomes is a significant challenge that all areas and all local authorities face. But we need to make sure we're doing the best we can locally for our children and young people, and have really high aspirations for them. Next slide, Phil. So just to give you a brief picture of Kirklees in terms of special educational needs and disability, we've got about 69,000 school-aged children. Currently, although it changes daily, we've got about 3,800 children and young people who've got an education, health and social care plan, which is a 44% rise since 2015. That rise is in line with national average, which is not to diminish it, but it's not out of kilter with the rest of the UK. Although locally we have seen a bigger increase with children and young people who receive support at what they call SEN support, which is a lower level of support for children and young people. So just to give you a rough idea, with about 11,000 pupils with SEND in the 2019-2020. Okay, next slide, Phil. So in terms of outcomes, there are a lot of, there's a mixed picture in terms of outcomes. So in terms of exclusions, our exclusions for our SEN children are higher than we want them to be. I think if you look at the figures, the national rate for our rate is 21.76, and the national rate for children being excluded with SEN needs is just over 15%. So not where we want to be. Permanent exclusion rates higher than we want it to be as well. So we're working really closely as part of the transformation plan to make sure we've got an inclusive offer and to reduce those exclusions. Also, educational outcomes for children and young people on SEN support are less favourable than the national average around key stages as well. On positive note, the statutory compliance in terms of completing plans, the 20-week target, we've increased that from 43% to 83% in 2020, which is an increase of 90%, which means children and families are getting a timely plan, which is good. Our NEET figures in terms of children and young people being in education, employment and training have increased to 83%, which is really positive. Have increased to 92%. But we're also seeing some challenges locally. I'm sure people will be aware we're seeing an increased demand for specialist placements for children and young people with learning disabilities and autism, an increased risk of hospital admissions. So, a real need to do something differently and intervene earlier. And also referrals for neurodevelopmental assessments have risen from 35 a month in 2019 to 75 a month in 2021. Waiting times have risen from 6 months in 2019 to 18 months currently, which is not where we want to be. Next slide, please, Phil. Thank you. So in terms of our self-assessment, some of our key achievements, as you've just heard, we've recommissioned the local offer and co-produced that with parents and carers, and that's really positive. We've launched our inclusion support offer to support practitioners, which is really starting to have an impact, which is great. I've touched on the fact that our EAT figures are good. Also, what we've done is we've invested a lot of money and time really in ways of capturing our impact in terms of data, understanding where children and young people's needs need to be met better, and making sure that we've got a refreshed approach to our quality assurance framework. We've got really good integrated commissioning arrangements in terms of innovative programmes, things like Thriving Kirklees and sensory occupational therapies. And we're just in the process of working with school inclusion partners at a case review where we had multi-agency teams around the table looking at previous cases and what could have been done earlier, and all the practitioners around the table agreed that we could have intervened much earlier in 73% of cases, which is really positive because it means there's room for changing and reorientating the system to early intervention. We know we've got too many exclusions, as I've outlined, and actually the other thing we need to do is look at transitions across all stages of childhood and into adulthood, we need a more holistic approach in terms of doing that. We've got a bit of a challenge in terms of education, health and social care plans and their reach. So currently it captures good educational outcomes, some good health outcomes and some good social care outcomes, but we need to move to a wider model where we're capturing wider care outcomes like early support, family intervention, where we're capturing universal health services and their role in supporting our children and young people and families. We've got a designated clinical officer, which is really positive, but we think we need to develop the strategic influence of that post holder more. So that's influencing our strategic planning and commissioning. And as I've said, some of our systems and services are currently under pressure. Children's therapies, neurodevelopmental provision, and also within our Send Act assessment team, we have got some capacity issues at the moment. Thanks, Phil. So these are the 7 inclusive ambitions, which are going to inform all our programme activity that have previously been to the Health and Wellbeing Board. And that's the basis for in which we're going to base all activity on. I won't read all those out. I'll carry on to the main part of the plan, Phil. I think that's just to outline the governance we've got currently. So we've got the Send Transformation and Commissioning Group, which is quite a large group. It's got about 30 to 35 people on. Across the CCG, health providers, commissioning, educational settings, parents. We've got children and young people's voice in there. We currently report into joint SMT and then ultimately to the Health and Wellbeing Board. We also report into the Children's Ambition Board, which is what was the Children's Social Care Improvement Board, but has got a wider remit now. And then underneath the Send Transformation and Commissioning Group, we have a number of work streams which are in relation to the transformation plan. Thanks, Phil. Okay, so the aim of pulling together one single transformation plan was to make sure that we had a data and intelligence-led plan, that we had a single plan for all the change activity going on, because there is a lot of change activity, and making sure that that was sequenced in the right way, making sure that our actions followed a logical sequence, really having the ambition to reorientate the whole system towards earlier help and earlier intervention. Needing to transform our local sufficiency. We want our children and young people to live and be educated locally, wanting to reduce our exclusions and wanting to improve our outcomes for children and young people whilst looking at the system spend and making sure that we've got a restorative culture and system throughout in terms of, the strapline, no decision about me without me, which I think was the old health strapline in terms of previous years. But nevertheless, I think that really holds true to what we want to do with our children and young people. So the Send Transformation Programme's got 5 work streams, and the first one's models of practice. So that's really about changing the way we work. That's about the restorative working. It's looking about how we make decisions with children and young people and families. It's how we quality assure our plans and our provision. It's how we make sure we've got a really clear outcome framework to evidence to what impact we're making for children, young people and families. It's also looking at something called the Value in Send tool, which is an outcome-based tool, which looks at the needs of children and young people, the needs of the ability of the educational setting to meet need, and the ability of the home to meet need. So it informs our commissioning about where we need to target interventions. So there's detailed project plans underneath that. Second work stream's inclusion, which is really does what it says on the tin. It's about making sure we have inclusive practice, we have inclusive settings. It's things like looking at our educational safeguarding teams, making sure that we've got a clear inclusion strategy, looking at our alternative provision across the board, making sure that's got the wraparound support to be able to keep children and young people in education, and also looking at our specialist provisional model, how our specialist provisions across educational settings can expand their knowledge and support other settings. Third work stream's early intervention, picks up on the inclusion support offer that we've been talking about and the local offer. Looking at a big issue for us, certainly feedback from parents has been, what we might call parents' confidence to care, their skills and confidence to be able to deal with sometimes difficult behaviour, and how early support and family support have got a role in that. So there's a big piece of work about how we can help with specialist knowledge to enhance parents' skills and abilities across the board. The fourth work streams are commissioning and sufficiency. So as you'd expect, that's looking at our joint commissioning strategy across the partnership, looking at our local sufficiency, making sure that we're using our capital resources and the capital investment we've got across education, health and social care to be able to have the right settings for our children and young people, making sure we've got really clear social, emotional and mental health provision to support our children and families. And as I touched on, developing the role of the DCO and DMO. The fourth work stream is preparing for adulthood, which is about that transition at all key stages, thinking about how we're always preparing our children and young people for the next stage of life, not just transition from children to adult services. And then the last work stream we have is the enablers work stream, which is really about how we embed children and young people's family engagement throughout the process, how we make sure we've got the right support services, producing the self-evaluation and making sure that we've got really good governance as part of that. So I think that's, I'm conscious I've whipped through that, and I didn't know whether you wanted to consider any questions around that based on the health and social care white paper, or as a board, you know, how could we help, you know, exploit opportunities really, and how we can better identify children with special educational needs and additional needs, how we can assess those better and how we can improve outcomes. Thank you, Chair.
Thank you very much, Tom. So I'm open to comments or questions from colleagues. And I'm not seeing anything at the moment. Gath.
Thanks, thanks very much, and thanks for the presentation. As you say, a rapid run through. But I'm going to do welcome what you're saying. A couple of things really. In another place, I've been with a team investigating services for children who are described as being vulnerable. I think the report's going to be out in September. And the issues that have come forward there are similar to the ones you've raised, and it'd be interesting to know how you respond to them. One is data sharing across different institutions, organisations, and how risky are you in doing so in terms of GDPR and all the rest of it. Second one is early intervention is everybody's positive, because it does make such a huge difference, well documented huge difference. But when the pressures, as you've shown in the figures you've given us, with the rise in the number of children who need help now, where do you get the funding from to shift resources from the here and now to the let's start early on? Because that's a big challenge. Third one is thinking about whether or not it's helpful to include youth justice or probation or even police in some of those discussions to try and prevent young people in teenage years from disappearing into various, being county lines, drug gangs, grooming, etc. Because they seem to be not included in this discussion that we've had. And obviously they have roles in the police with specific requirements to do that. And sorry, there's so many questions, but just...
I'm writing them down.
And that links to obviously exclusion rates, and how do we, as a education and children's social services, health services, how do you link that to try and prevent exclusions? And lastly, one of the I was with Kevin Collins yesterday, and one of the things he made absolutely clear was, young people have missed 115 days of school on average since COVID, and are 3 to 4 months behind in literacy. there's another figure for numeracy, I think it's even higher. But the children who are in the SEN bracket are even further behind. You know, well, you can add a couple of months onto that. So how on earth are we as a group going to try and, in order to achieve the ambitions that we have, try to address that? And I'm sorry there's so many questions.
Oh, no.
But there are a lot of issues.
Yeah, no, that's most welcome, Councillor Pinnock, and I'm sure Mel will want to probably jump in on the last question, I would imagine, particularly. In terms of data sharing, I think it's tricky, isn't it? I think where we've got a statutory basis for it, e.g. the Children's Act, I think it's less complex, isn't it? And particularly in terms of the Education, Health and Social Care Plan, it's less complex. What is a real challenge is that wider population management issue, and I think we are working quite closely with particularly NHS colleagues about how we can better share information to help identify where we have got NHS numbers and GP registrations, how we're using that for population planning, and how we're making sure we join that up across. And of course, one of the other ways that we do that is when we shift to a more restorative approach. We want all the people in the room being able to share the information with the permission of parents and children and young people. So I think your delivery model can drive that somewhat, if that makes any sense. There continues to be challenges between systems and information sharing, but I think we're pretty good locally at that, particularly in relation to children with additional needs or SEND. So yeah, but always a challenge. In terms of the early intervention, completely understand, it's the age-old problem, isn't it? In effect, how do you reorientate the system to early intervention where you've still got the high cost spend in the system? And I think what we need to do, we've taken a look at the whole system spend around special educational needs and disability, and where we're spending the majority of our money, unsurprisingly, is at the high end. And I think part of what we do is we through some of the interventions we're thinking about, like looking at the way we work on panels, looking at the inclusion support offer, that starts to free up some of that resource, because actually what we do, instead of incentivising a statutory plan, we incentivise support at a lower level. That's not to say that everyone's got a statutory right to a plan, but we incentivise support outside the system. But I think that has got to be a gradual approach, and also we need to look at ways that we can use the partnership resource to invest. And the one of the examples I always use would maybe be something like our children's therapy provision, our speech and language occupational therapy, that actually, because of the immense pressures on that service, that generally they prioritise children and young people with an education, health and social care plan. But if we could actually pilot a way of saying, well, actually, if we identify needs in a certain area or hub, putting some resource in there early without incentivising the HC plan actually might take some pressure off services. So I think we've got to do a bit of invest to save and get some really clear business cases around that. Particularly, yeah, and I think it's a really good point actually in terms of the probation and youth justice involvement in the SEN transformation and commissioning group and the development of the plan, because I think obviously we know, don't we, that children and young people with learning disabilities or SEMH problems or speech and language problems are overrepresented in the criminal justice system. And actually how we put interventions, we do have a joint team in there as part of our youth offending service, but there's far more we could do. So yeah, and then your fourth point about exclusions, I really think the only way we're going to bring exclusion rates down is to really have very inclusive settings, but have a multi-agency approach to it. We have our mental health in schools teams, we have our early support, and what we need to be doing is wrapping support around families, children's and educational settings to be able to help those settings to meet need. I think on terms of the literacy and numeracy and bringing children and young people back up to the level we want to see them, I think Mel's probably very much more embedded in that than me, so she's probably better off answering that question.
I see Mel's put a hand up, so come on, Mel.
Thank you. Although on that question, I think Councillor Patterson would be able to do just as good a summary about what we're doing around education recovery as I would. But I'll start off, and then if I miss anything, I'm sure Councillor Patterson will remind me. So. Councillor Pinnock, that they're really helpful questions, and they're all the things that have been challenging us, I think, actually, as we've been developing this transformation plan. My view is that as much money as that we can get into early intervention will help us, and I think already other local authorities, there's only one that we've been looking at where they've used the new helpline approach, are already seeing less children having plans, and for a few months ago, for the first time, had more less children starting a plan than they had closing, which means they've got more money to invest earlier on. They can already see some savings in that. So some of the things in our transformation plan are about slowly, because it's really important that we do this with families, but slowly we start to be able to take some money out. You'll also be pleased to know that we are negotiating with the government. Individually, we've been invited to negotiate with the government. We've got to submit a business case for some additional funding in this area. So you'll know that the council's been subsidising the school system around SEND significantly over the years, and we're in the second round of councils who are around the table trying to claw some of that money back. You may be aware, or may not, but actually there was a fair funding formula review for children with SEND a couple of years ago. It was acknowledged in that funding review that Kirklees were significantly underfunded. The government decided that they weren't able to give us our full amount that we were entitled to straight away, because they wanted to build those that were entitled to more up slowly, so that they could bring those that are getting more that need to come down slowly. So actually we are seeing more investment year on year. My discussion with the government has been, well, why can't we have that money straight away if you acknowledge that we've got a deficit in our budget, because that would have given us money to invest in early intervention. It will certainly help us to balance the books, which I think if you are starting from a balanced book perspective, it's much easier to invest in early intervention than from an overspend perspective, which is where we're on now. And our current overspend is running at about £5 or £6 million a year, so it's significant in terms of and that's been building over the last few years. So I'm hopeful that we will be able to invest more money in, and of course the council's already put some money aside to put some extra special school places in. Again, trying to make sure that we can meet children's needs much more holistically, but most importantly in Kirklees. We send too many children out of Kirklees to get their education, so that's going to be really important for us. In terms of youth justice, it's really interesting. We've just had a youth justice inspection, and one of the things that they told me was that on every member of staff in the youth justice team's wish list when they were interviewed was speech and language therapy. I think there's something that we've got to work on to consider how we can introduce that. And certainly we are moving to a model in the youth justice service where every young person who comes into the youth justice service will have a health assessment. So at the moment, the way it works is they only have an assessment done if they've got presenting health needs. So we've been waiting until something emerges before we do the assessment. So again, that should help us to pick up, particularly around communication and language needs, I think. And then there's sort of in terms of education recovery. So we're doing a big piece of work, and we were doing this pre-COVID. It's just that COVID has given us more of an impetus, I think. Is to have a 9-year learning strategy, which will focus on trying to close the attainment gap from those that are most vulnerable. We'll want to address moving to an inclusive school system. So the challenge that Councillor Patterson and I have put out to our head teachers is if we move to a no permanent exclusion position collectively, what would it take? What do you need from us, from a collection and a system, to enable us never to have to permanently exclude a child? So that's the challenge that we've put out there, and I think will be one of the major focuses in the first 3 years of the education strategy. So we're hoping that the learning strategy will be launched in the autumn. So there'll be opportunities for people to have a look at that, but the real focus will be about addressing inequality, which clearly this cohort of children absolutely experience. So it'll be about addressing inequality and trying to close the attainment gap through that. So there will be a significant focus for the outcomes that these children are achieving for that. I mean, I think we have got some innovation. I think some of the work that some organisations are doing around employment for adults with learning disabilities, I think, is brilliant. I think that thing about it's, you know, it's not just not focusing just on the school system, and you'll see in the transformation plan that actually the transition into adulthood is the really important preparation. We're not calling it transition anymore. I can't believe Tom didn't roll his eyes at me then.
Was being polite.
I know. But the pathway into adulthood needs to be much more secure, and I think we have too many children with disabilities and attending school at the age of 19 and 20 and just doing a perpetual circle of courses without actually ever getting to a place where we can help them into the workplace, which is what we really want, and into independent living as well. So I think certainly the Youth Justice Plan will be addressing some of these issues, and then we've got the learning strategy, which will pick up on the education and recovery. Thank you.
Thanks both very much for those comprehensive answers. Thank you.
Thank you. Tom, are you signalling you need to come in?
Yeah, sorry, Chair. It was just to say one thing as well. As we've been doing a lot of the engagement with frontline practitioners and people, one of the things we have picked up, and we picked it up through a staff event yesterday, was that people aren't particularly confident at understanding special educational needs and disabilities or additional needs and some of the hidden disabilities. So I think one of the things I should have said as well is in terms of our workforce strategy, I think we're really going to need a layered workforce strategy across the partnership so that people are more comfortable in identifying and talking about. And, I know language, isn't always important, but I think it is in this arena that I'd like us to start talking more about additional needs rather than special educational needs and disability, because I think people understand that more and it doesn't seem so niche, if that makes any sense, and they can relate to it. So I think we've got some cultural and workforce aspirations that we need to achieve as well. But that was it, Chair.
Thank you. I see Mel's put a hand up again as well.
Sorry, Chair. It was the last bullet point on my list that I didn't get to. So I think Tom's call out really in terms of helping us to better early identify is going to be crucial to us being able to deliver on this sort of reinvestment and investment in early intervention. And I think one of the areas that we could do much better on is how we work with GPs in terms of their roles in identifying children in this position. So I think there's something that we will be asking colleagues on the Health and Wellbeing Board to be thinking about how we might better engage GPs in this discussion so that we're able to utilise the level of contact they have with children and families to make sure that the referral pathways are clear enough and that we've got, as I say, that early identification. So the sooner we can provide help, the better. So I think we've already got well-established links with Locala and some of the other providers, but I think GPs is an area I think we'd like to do more work on.
Thank you very much for that. I'm just wildly trying to turn my phone off, which won't stop ringing. My apologies for that. I'm not seeing anybody else wanting to make a comment. I think there are an awful lot of challenges within the assessment and in the transformation plan. I think the challenges that we're up for, and I think it's heartening. I do think children and young people really in past years didn't feature at the Health and Wellbeing Board, and we've made a concerted effort to make sure that occurs, and it is heartening to see. And of course it doesn't exclude adults, and children are part of families that have adults in them, I see Dr. Neema's got his hand up, so please go ahead.
Thanks, Viv. I just wanted to know from Mel, how do you think that GPs can support and help in it? We've got regular meetings with the 0 to 19 practitioners. GPs meet them regularly, and we've got social prescribers which help us with some of the community links. And I'm just wondering, how we can utilize these resources to support.
Yeah, so I think I think there's some workforce development issues we've got around understanding the whole workforce, understanding what's available out there, use of the core offer, the offer as we talked about, the local offer. So I don't know how well GPs are using the local offer. Are they signposting it? Are they aware? Some work I think in terms of raising the profile of that. And one of the things that families tell us is really frustrating is that they feel like they have to wait for a diagnosis, so that we use a medical model, and that they have to wait for a diagnosis before they get any help and support. And I suppose what we're asking for in the transformation programme is that the identification that there are issues, regardless of whether we have a diagnosis, that's the time when we need to get in and be providing support for families. So really just trying to work with GPs and social prescribers and others to be clear that actually we want to hear from them. We don't want to wait until children have gone through often what can be multiple assessments to find out what the issue is, and that is very frustrating for families because their experiencing and how we support them to parent will absolutely have an impact on the types of support they're going to need in the longer term. So I think having some of that dialogue with GPs and the GP networks, thinking about how we better do that, and certainly some of the GP networks really engage well with the school and community hubs, but others not so. So how do we make sure that we can encourage all members of GP networks to work well as part of the community hub? So there's some things around that, I think, but that notion about we don't need a diagnosis to be able to provide help, and how are we making sure that all practitioners who are meeting with parents who might be talking about how difficult they're finding their child or things that they're worried about, that's the time when we really want to be talking to families, and so we can help them to plot a path through what is a really complex system for them to navigate.
Okay, Tom, I notice you've got your hand up.
Sorry.
I just urge you to be quick because I am aware time we've overrun.
Yep, sorry, just to say as well, Dr. Naeem, that we'll be bringing it into clinical strategy group as well for some of those clearer conversations, so we can pick some of that up then.
Thank you. Yeah,
Thank you very much. Thank you for the comments and the questions and the responses. I think it's a tough hill to climb, but I'm confident that we're going to make some huge improvements if we can work together. Can I move us on, please, to item 11, Children and Young People's Plan Priority Updates? Mary, I think you're going to be doing this, are you? Are you the lucky person?
Thank you, yes. Thank you, Councillor Kendrick. I'm going to attempt to share some slides, so let's start with that, see how we go there. While that loads, hopefully, and it looks like it's doing that. Thank you for having me. My name is Mary White. I manage the Kirklees Children and Young People's Partnership here in Kirklees, and that's a partnership that's open to anyone who works with and cares about children and young people who live in our area. And what we do in the partnership is look at a range of qualitative and quantitative evidence about children's experiences and what works to promote good outcomes for them. And we're currently focusing on 3 areas that are our priorities. So I'm here to update about the partnership's work on those priorities in the children's plan, because you as a health and wellbeing board provide the governance for the children and young people's plan. So it's important that I come and let you know a couple of times a year where we've got to. Before I launch into my 3 priorities, I know that there's been a lot of conversation around children and young people's mental health as a result of the pandemic, as well as it being, a general concern at all times. And because of that, our last partnership session on the 21st of June had a particular focus around children and young people's emotional health and wellbeing and mental health. And we were trying to take very much an asset-based approach to that. So what provides the right circumstances and support and environment to support good mental health outcomes for children and young people. There was some great presentations there, some really good practice, and we'll be reflecting on how we take some of that forward, which might feed through into future priorities, I think, and thinking about our strategic arrangements. But we had a good resource pack that was put together from that. So if anybody would like that sharing, I can get that sent out through Phil as well. But to come back to the Children and Young People's Plan, as a reminder, it's a non-statutory plan. It's produced with partners across the children's system, so that includes some of the organisations around the table here today, lots of faith and community and voluntary organisations, a whole range of people who work to support children and young people, whether that's in very universal services or in quite specific settings and for quite specific interests. And the plan intentionally focuses on complicated issues, because the point of the partnership is to bring together people from right across the piece. So that enables us to have a lot of different voices and interests at the table, and to be able to consider issues that are complex and multi-causal and need changes in culture, to do that in the round with our partners. You'll have had papers that will explain the rationale for the priorities that we've got and what we're doing to identify trends. And you'll notice that my presentation today is a bit light on data, and that's because many of the data points that we use are collected annually, and I've got no new information to give you since I came to see you in November, with one notable exception that I'll come to. So our 3 priorities. The first priority in the Children and Young People's Plan is to improve inclusion and outcomes for LGBT, lesbian, gay, bisexual and transgender young people. And the way we manage this work is through a strategic group, which is made up of representatives from us here in the Council, from Kirklees Youth Alliance, from the Brunswick Centre, who are our specialist LGBT local organisation, the base, Northorpe Hall, who provide Tier 2 mental health support services, and some colleagues from the university. And we organise the work across these 4 settings that I've got here. I'll try and pick out a few examples for you of progress that we've made with each of those 4 work streams that we have. So developing people, practice and resources is about responding to colleagues saying, we want to do more to support LGBT plus children and families. We're not quite sure sometimes what the right language to use is or what the right intervention is. So there we've been developing some best practice resources as like a help yourself, being able to signpost people to good resources to use to help with their professional development. We've also been running a series of webinars around sexual orientation and gender identity to do more sort of intensive work and to work with people who are working with live cases. And from that, we're trying to build up a champions network of people across our agencies who've got a particular interest and knowledge and who colleagues can refer to go to for support around addressing some of those issues. And some exciting pieces of work coming out of that as well. We've just seconded a family support worker from our own early support service to the Brunswick Centre, because the early support service recognised they wanted to improve their skills around working with LGBT plus families. And the Brunswick Centre had a huge demand for support in that area. So this way, the Brunswick Centre get a family support worker, and we get lots of skills and knowledge and interest being brought back into our mainstream team, which is great. Voice and influence work is as important, with LGBT young people as it is with any young people, and we do that both for specific groups, asking people with those protected characteristics for feedback, and we listen to some of the things that they tell us. There's some great mystery shopping projects that LGBT young people have been involved in, who go out and visit our services and then give them feedback as to what they felt about the service that they received and how improvements might be made. And we also do some work with generic youth provision to help them to look at an inclusive curriculum and to think about how inclusive their provision is as well. Celebration and visibility is about the way that we contribute to events like Pride and the International Day Against Transphobia and Homophobia, and History Month, because we think it's important for young people to have visible role models, to be able to know their history and to be able to see adults leading positive lives. And the 4th area around data and intelligence is we've got this as a priority because for the first time in 2018, we asked young people in the Year 9 Health Survey to tell us about their identity. And what that threw up was an understanding that for young people who identified as LGBT+, there were some real gaps in their outcomes compared to their peers. So it's about the power of data, really. Having learnt that from the health survey, we're now interested in how we can use that same methodology in other services to be able to see what some of the differences and experiences for LGBT young people are. Some of that work has been held up because of the pandemic, but both Northorpe Hall and C&K Careers are hoping to start some pilot work around doing some work around data and intelligence, which will really help our insight around that. Swiftly on, our second priority is about the youth development programme. It's about having positive places to go, people to see and things to do for children and young people. And that became a priority because we'd lost an awful lot of youth work provision in the borough over about a 3 or 4 year period up until 2019 or so. And it was recognised that provision is really important for providing an opportunity for early intervention with children and families, having a trusted place in your community you can go to, a trusted adult you can talk to, where you might be able to have conversations, reveal things that are concerning you, risks might be identified, that we can begin to have nip things in the bud rather than let them escalate. And the loss of our youth provision had made that quite problematic. So youth development programme launched in 2019, and these are the 5 different work streams that we have there. So a significant amount of the work, it has to be said, in the last few months has been about responding to the pandemic, whether that's been about how do you create provision and activities online when guidance changes, being able to support groups to identify what's safe practice, what isn't, where you can do targeted work with young people at particular risk. So a lot of work's gone into doing that sort of support with our community organisations. But the community youth work offer is also quite involved at the moment in creating a map of all the provision, which will link through to the local offer as well, so we get a good picture of where there's activities and things going on for young people in community settings. And that's being led by Kirklees Youth Alliance. They're also providing oversight for the holiday activity and food programme, which will be the biggest ever summer holiday programme in Kirklees, you'll see in the coming weeks. There's 50,000 places on 99 different sites across Kirklees being created particularly for vulnerable families and children who are entitled to free school meals. On top of that, the council has also decided that it will be providing free school meal vouchers as well. So hopefully a brilliant offer for our free school meal families and children in the coming weeks. The prevention pathway is looking at targeted support. So a lot of that is around detached youth work and contextualised safeguarding for young people who are at risk, who are at the edge of potentially getting exploited in one way or another. So a lot of that prevention pathway is about integrating knowledge and understanding across organisations and using the detached work stream, the detached youth workers to deliver activity to intervene with some of the concerns that there are there. Our youth practice model was a work stream that we've just brought to an end, actually, because it's done its work. We've now created one youth engagement service to bring together what was formerly different services. So we formerly had a risk and vulnerabilities team, a youth offending team, a youth intervention team, and there was quite a lot of cross-referring and similar, same cases being involved in different teams. So it made sense to bring that together. In a team that includes youth workers, social workers, people with a health background, multi-systemic therapists, the police and so on, with the idea that we provide the right support at the right time by the right person instead of cross-referring children and young people across different agencies. Places to Go is about the work that we're doing to try to develop facilities for good youth work, whether that's potentially some new flagship buildings or whether that's about good sites in community settings. And the 5th area here around tackling inequalities is a new work stream for us. And that's particularly to make sure that we bring children and young people's voices and experiences into sight and can share some of our insight with the Inclusion Commission that's just beginning its work. The third and final priority is about reducing the effects of poverty on children in Kirklees, because whatever outcomes you look at, whether you're looking at education outcomes, health outcomes, whatever it is, if you look at children who live in poverty, they are very significantly more likely to achieve the poorest outcomes. So one of the ways that we can help to improve children's outcomes is by working to tackle poverty. At the same time as the Children's Partnership we began to look at that, the Tackling Poverty Partnership was also relaunching itself. So it makes sense that we've brought those two pieces of work together to collaborate and to have children and young people and family poverty as one of the key themes in the new action plan. Again, it's one of those areas where over the last few months, quite a lot of the focus has been has moved to pandemic response as opposed to the longer term, more developmental work. But I think we're moving into a phase where we'll be moving back towards that. But one of the stats that I have got for you today, I think, is really very telling about the impact of the pandemic, which is that in January 2020, last year, just before the pandemic, we had 19.1% of our school cohort was eligible for free school meals. So 1 in 5 of our children was eligible for free school meals. When we ran that census again in January, which we do every January, that figure had gone up to 23.9%. So from almost 1 in 5 children and young people in the borough to almost 1 in 4 children and young people in the borough, which kind of highlights the need to really focus on poverty as an issue for the way that we're working with children and young people and families, and trying to think about how we bring poverty aware perspectives to when we're doing assessments with families as well, to make sure that we can support families to get support the support that they're entitled to and can access. So the poverty work has been around immediate relief and holiday programmes, and about some work to make sure that we, as we work on economic recovery, we don't lose sight of children and young people in that, because young people entering the labour market have been particularly impacted by the pandemic because of the nature of the work that they do and the stages of their careers that they're at. Longer term, we'll be looking at doing some more collaborative work with schools when they're ready for us to be able to do that, around how they can poverty-proof some of their practices, how we could improve take-up, because we have some schools with quite high numbers of free school meals children and low take-up, and others where it's much higher and great take-up, and also some work around financial literacy. I'm going to stop there because it's now we're over, aren't we? Thank you.
We are indeed, Mary, but thank you for that. I find it fascinating that most of the officers seem to have been on training courses in speed speaking, you know, and I'm very grateful for that. So, colleagues, we're asked to comment on the plan and also to continue to endorse the working arrangements of the partnership. I don't know if anybody has any comments or questions as such. I mean, it was quite comprehensive, and the documents in the papers do explain an awful lot of it. Any comments? I'm not seeing anybody as such. No. So then, Dr. Khalid Naeem, come on.
Yeah, I was just wondering how much of this work is going in tandem with health inequalities initiative. I think Rachel is leading on health inequalities, part of our work and initiative. Yeah.
Good question.
Yeah.
No, it's a good question. It's an important question, because one of the things that's really important for us at the partnership is that what we do is very evidence-based. So one of the sort of the suites of data and evidence that we look at is very much around children's outcomes and children's experiences of health services. As I was saying, we've recently spent quite a bit of time around looking at emotional health and well-being and mental health services. And the poverty work that we do is really quite closely aligned with work around health inequalities, because that's led through our public health department as well. It makes no sense to do it otherwise, really. I think. I don't know whether there was a specific. Yeah.
You know, I understand. I'm just thinking there are so many streams of that health inequalities works going on in primary care, in obviously the mental health, learning disabilities, and then so I'm just thinking that where do all these things join together? You know, do we have any collective approach to it?
Yeah, Rachel's got a hand up. I hope she's going to help us with that.
So yes, and it's an excellent question. So we have an inequalities program, which we've got program management support to pull all these different bits of work together. And obviously that will be broader than health inequalities, include all inequalities. I think there's always a real challenge, though, between what we want to do is not create something so bureaucratic that progress isn't made. So I think it's that sweet spot between managing the key pieces of work that need to be reported and progress updates and understanding the interdependencies, but also acknowledging that really the goal is for everyone to think about inequalities in everything that they do. So the programme is about making sure we've got that rigour in place. But if we get this right, it will become second nature to everyone in terms of how they deliver services. So there's definitely a programme that we can share the details of in terms of what that contains, but it will be not capture absolutely everything, because I think what we're trying to empower our staff particularly is to say, you know, you need to think about inequalities in everything you do. And I think for me, it chimes a little bit to how we've approached partnership working, where it was something that we felt like we had to manage, and now people by almost second nature have conversations with partners because it feels like everyone's part of the same system. But I'm happy to share more details about the inequalities programme so that you can see the range of work that covers.
Thank you.
Thank you. Any other comments or questions? Are we happy then as a board to continue to endorse the working of arrangements of the partnership, which is what we're asked for? I'm hoping I'm not seeing any dissent, so I'm taking that as agreement. All right, Mary, I'm really sorry we squeezed you up in a busy agenda, but thank you so much for your presentation. It was really useful.
Thank you for having me.
Thank you. We are now on to item 12, which this is the challenge, Phil. We've less than 15 minutes left of overrunning before I have to be at another meeting. We're already overrun the board, and I'm sorry for that, colleagues. But Phil, over to you. Developing the Kirklees Joint Health and Wellbeing Strategy.
Thanks very much, Vivian. If Mary was on 33, I'll try and do it on 78. So.
Okay.
We've shared a paper in, but also create. Oh, that's gone a bit weird.
Yeah, everybody keeps disappearing on me. Oh, you're all back.
So I'm going to stop presenting that because it's gone a bit funny.
It looks okay to me. But every time you switch it off, the whole board disappears for me.
Okay, I'll stick with it. So the board be aware that one of the responsibilities the board's got is making sure we've got an up-to-date joint health and wellbeing strategy that reflects the joint strategic assessment that the board signs off on an annual basis. So this is just to update the board very briefly on where we're up to with the work on the refresh, and just and hopefully get the board's endorsement for the approach we're taking. So people might remember, particularly those of us with long memories, that the first joint health and wellbeing strategy was published in 2014, and it's useful perhaps just to have a quick glance at some of the content. I'm not going to dwell on it, but several of the things we've talked about today feel like they're things that we've been talking about for quite a while. So it does feel like work in progress as opposed to job done. We talked about quite a number of system changes 6-7 years ago, and all of those are progressing with varying degrees of success. Some very well, and we've talked about them today. And you know, if you think about digitization, where we've come from since 2014, and how we, for example, how we're using digital approaches, and the local offer being a great example of that. We also had an approach we call the strategic thinking framework, which I think is probably now, in terms of terminology, morphed into population health management, about getting people to embed that thinking process about how we use evidence, and how we use a much more sort of thoughtful approach rather than just responding to present need. The Kirklees partnership has endorsed an approach to the high-level strategies across Kirklees, which we're sort of colloquially calling strategy triangle, which is about the joint health and wellbeing strategy, the economic strategy as we've had previously, but also now the third leg of the triangle being the inclusive communities framework, and a common focus for all those things in terms of outcomes and inclusion and inequalities. So it's really echoing the point Rachel made about inequalities being a thread through everything that we do. We've already got a vision outlined in the current joint health and wellbeing strategy and a set of values, behaviours and leadership principles. And part of what we'll need to do through this work is just reflect on those and see if they still feel appropriate, or do we need to tweak them slightly to reflect the context that we're working in. People will be aware of the Kirklees outcomes. I can see them behind Councillor Kendrick's head. So part of what we need to do, and we've discussed it previously, the board, is just look at how we're actually monitoring our progress towards those. And we've got a suite of indicators that we need to reflect on and update. And there's also some work going on around an additional outcome, particularly thinking about what the citizens' outcome might look like, which is trying to capture how much in control people feel of their own lives and how much they can influence what's going on, which was actually one of the strands that you might recall from the second slide of what the joint health and wellbeing strategy said we should be trying to do. We've got more than just developing the joint health and wellbeing strategy to do. People will also be aware from discussions at previous meetings about the health and care white paper, and the bill has now been published about the need to introduce a new set of partnership arrangements, which are being called the Kirklees Integrated Care Partnership. And we'll also need to translate the health and wellbeing strategy into a plan, so people are clear about the specific actions we're trying to take, which again, just going back to that point about the inequalities programme and how we can connect together the threads for people to make sure that we're not diluting our efforts. The health and wellbeing plan will provide the sort of the overarching plan, but there's also a recognition the fact we'll need locality plans, we'll need organisations will need their own plans, and there'll need to be work streams covering things like starting well. We've heard about one of the main planks of that at this meeting in terms of the SEND work around SEND, and that also weave in the Children and Young People's Plan. So the board might remember that's the current health and wellbeing plan. We've summarised it as a plan on a page, and I think where we're really wanting to take this is not to have a 90-page document that nobody reads, but to try and distill the key points and the key actions and the key elements of our approach into things that are much more compelling and engaging, as with the local offer, which has gone through that sort of iterative process to go from something that looks a bit to be honest, staid and boring to something that hopefully will be engaging, that people can get enthused about and feel like they can contribute to. So we've thinking about what's already in play. There are some key ideas that feel like they're really important to the way things have evolved over the last sort of months and years. I've just highlighted on that slide the things that feel like they're different from what we said in the existing joint health and wellbeing strategy. Much more emphasis around localities, much more emphasis around the provider collaboratives and alliances, much more emphasis around the climate emergency, which intriguingly we didn't mention at all in the 2014 strategy, and a much more emphasis on us being able to tell the story of what's going on, how we're trying to change things and the difference we're making. So we had a session with the board a few weeks ago, and we've tried to summarise some of the key points that came out of that. And my colleague Alex Chaplin is just going to take us through some of those points.
Hiya, I'll be super quick. So in terms of ambitions, a lot of the stuff that was coming out of the session was that we have created sort of new ways of working, that it feels like that we have sort of gone beyond eligibility and all these rigid ideas of how health and care should work, and we need to carry on that because actually the positive risk taking has got us some really good outcomes, and this is something that we should continue. And of course, as well as discussed previously, there's been an increased focus on equality of access, inequalities in general as well. So we need to keep a focus on a bit of a covenant between people, organisations, places, about how we can take all of this sort of good learning forward and put it into the strategy. Next slide, please. In terms of risks, I'm not going to read everything off the page, but there were thoughts about sort of money flow, about if other places have ready-made schemes, how are we going to be able to fit into that or put our bids in. Maintaining focus as well came up quite a lot, particularly in my session, about how we don't want to repeat mistakes of the past about becoming too hyper-focused on our own organisational context. That again, we've got to take this learning that we've got from COVID and take it forward about how we've been really pushed to work on an integrated level that we haven't seen before, and we need to just maintain the focus on that, on those ways of working. And then lastly, we spoke about opportunities as well, which are there for you to read. Again, very similar. COVID has reset our focus and abilities. Things about like the twofold role of the Health and Wellbeing Board as well. So I'll pass back to Phil. Whew, out of breath.
Thanks. That was 78 plus that. So we've got some ideas about the overall approach, and I think the key thing is probably about being ambitious and co-production. I think there's a real sense that in terms of coming out of COVID, people want to be optimistic and ambitious for the future of themselves, their families, their communities, and for Kirklees as a whole. And we want to try and capture some of that ambition. And as we've said numerous times already in today's meeting, that sense of building this together rather than it being something that's just done by a few sort of council officers. So in terms of how we're going to do that co-production and work together, our sense is that we need to have 3 conversations with people. One is, what do we need to understand about the needs and assets that we've got now? What do we know, and what do people want to share about their ambitions, and also what works in helping us achieve those? We also need to have those conversations in particular places, recognising there's a lot of work going on a locality basis, and we need to understand the differences in different places, the different life stages in terms of starting well that we've covered a lot today, but also living well and ageing well. There are some particular themes that we need to talk about. Obviously, what have we learned from COVID, co-production, digital, and certain structures that we'll probably need to talk to, recognising the fact that there are existing structures and organisations, understanding what needs to be done and how we can deliver it. So in terms of the next steps, assuming the board's happy with that proposed approach, we're going to be working with partners and lots of different people about trying to build that understanding of what the needs, ambitions, and what works is. We think it would be useful to have an informal session with the board in September, just to sort of give an update on how those discussions are going and what the main themes are that are emerging from that, with a view to bringing a draft of the strategy for endorsement to the board meeting in December. If I stop sharing my slides. Oh, got the right button now. Has Councillor Kendrick had to go? Richard, you're on mute.
I was going to say, it looks like it.
Yeah.
So, Councillor Pinnock, you posed a question about how we can engage councillors in the development and contributing towards the plan, which feels a really helpful question. Perhaps is one we could just ask Phil and colleagues to take away and think about how we do that.
Sorry, Chris, Richard, if I can just mention that, I think that's partly the question about the places and making sure that, obviously I've had a conversation in localities, would want to have engaged councillors in that, but also through those structures and strand.
Okay.
Sorry, Richard, can I just come in and answer to that? I mean, I think, so, and we need to know what's there, and we don't, I bet most people don't.
Thanks, Kath.
Absolutely.
Khaled, I don't know whether you'd seen in the chat that having been elected as Deputy Chair, Councillor Kendrick was wondering whether you could just get us through the last couple of minutes of the meeting and finish. This was the last agenda item. Okay, thank you very much. It's a privileged position I've been given to control everybody. Okay, no, thank you very much. Yeah. So this is a last agenda item, isn't it? So, you know, have you got any further questions on that? Anybody who doesn't seem so? Has anybody asked for any other business? At the beginning?
No.
And have we got date for our next meeting?
Yes.
Okay.
Yes. It's the end of September. I can't remember the exact date, but that will be communicated to board members shortly.
Okay, no, that's fine. That's fine. I think it's on 30th of September, as I can see.
30th of September.
Yeah, on my calendar. So 30th of September, 1 o'clock start, 1 till 4. I think we are going to close the meeting. I think, yeah, it's probably the easiest part Viv has given me. That's fine for a starter like me. Okay, so we'll see you in September, and up until then, have a nice holiday.
Thank you.
Thank you.
Thank you.